Hello everyone, I am Vaishnavi Chaudhary and I will discuss sympathomimetics, that is adrenergic drugs. So before starting the pharmacology, we will discuss the physiology that is normally present. So whenever there is a stress situation or the activation of the sympathetic system, the sympathetic outflow will be released, and from the spinal cord to the smooth muscle there is a ganglia between them. So before the ganglia is called as a preganglionic part, and after the ganglia called as a postganglionic part. So AN is actually divided into the parasympathetic as well as sympathetic system. So in parasympathetic system, the preganglionic part is acetylcholine and the postganglionic part is acetylcholine. In case of sympathetic system, the preganglionic part is acetylcholine, while the postganglionic part is the adrenaline, noradrenaline, dopamine, and acetylcholine may be in very little amount. Right, noradrenaline releases from the postganglionic nerve fiber and the adrenal medulla, because there is a one other way for releasing this in case of the adrenal gland. When there is activation of sympathetic system, the one connection goes to the adrenal medulla, so that leads to the release of the hormones into the blood circulation, epinephrine, and they crosses the neuronal barrier and blood neuronal barrier and enter the nervous system and show their effect. So now we will see the del vasomotor reversal. So it is shown by the epinephrine or the adrenaline. So it acts on both alpha-1 as well as beta-2 receptor. So alpha-1 receptor show the vasoconstriction, while beta-2 receptor show the vasodilation. So alpha-1 receptor are strong receptor and beta-2 receptors are the sensitive receptor. So less amount can stimulate this receptor. So we will see the two examples. So in case of pheochromocytoma, there is a tumor of the adrenal medulla. So in that case, there is a high amount of the adrenaline. So initially, high amount can stimulate both alpha-1 as well as beta-2 receptor. But after some time, because of metabolism, there is a decrease in the amount of the adrenaline in the blood that leads to the stimulation of only beta-2 receptors, that is sensitive receptor, that leads to vasodilation only. So next example, that is experimental example, can be done by using the alpha blocker. So there is a blocking of the alpha receptor, so only beta-2 response is shown, that is called as the vasodilation response. So we will see the receptors. So in sympathetic system, there are two types of receptors, alpha receptors and the beta receptors. Alpha receptor contain alpha-1, alpha-2, and beta receptor contain beta-1, beta-2 and beta-3. Remember one thing, when the action is on the alpha receptor, that is alpha-1 receptor, action is constrictory or the stimulatory action, like vasoconstriction or the bronchoconstriction. But when the action is on the beta-2 receptor, there is a dilatory action or the relaxing action, like bronchodilation, vasodilation. So alpha-1 receptors are present on the smooth muscle of the bronchi and the blood vessels, then uterus, then prostate. Then alpha-2 receptors are present on the penis that leads to ejaculation. Then beta-1 receptors are present only on the two organs, that is kidney and the heart. In kidney, there is a secretion of the renin that leads to the increase in blood volume, and indirectly that increases the cardiac output. On the heart, they show the stimulatory effect like increase in contraction, increase in conduction velocity, indirectly increase the cardiac output. Then beta-2 receptors are present on the smooth muscle of that uterus, then bronchi, then blood vessels, GIT, urinary bladder. Then beta-3 receptors are present on the adipose tissue, and that leads to the lipolysis. So now we will see the uses. So adrenaline uses can be remembered as A, B, C, D, E. A for anaphylactic shock, B for bronchial asthma, C for cardiac resuscitation, D for prolonged duration of the local anesthesia. Then E for epistaxis and the capillary using selective B2 agonist used for the premature labor, hyperkalemia and bronchial asthma because of the B2 action. So next is dopamine. Dopamine is used for the cardiogenic shock and the septic shock, severe heart failure with the renal impairment. The classification of the drugs on the basis of the function. So they include the 7 categories: pressure agent that increases the blood pressure, then nasal decongestants that is present in form of the drops and they use to open the nose. Then CNS stimulant, then uterine relaxant, then anorectics. Anorectics depresses the appetite center, so it can be used to treat the obese patient. Then cardiac stimulants and then bronchodilator used in the asthma. So examples are pressure agent, noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine. Then nasal decongestants, xylometazoline, oxymetazoline, afazoline, phenylephrine. Then CNS stimulant, amphetamine, dexamphetamine, methamphetamine. Then uterine relaxant, ritodrine, salbutamol, anorectics, amphetamines, fenfluramine, sibutramine. Then cardiac stimulants, adrenaline, isoprenaline, dobutamine. Then bronchodilators like salbutamol, terbutaline, isoprenaline, salmeterol, formoterol and bambuterol. Now we will see the administration and the preparation. So adrenaline for systemic action 0.2 to 0.5 mg subcutaneous or IV is given. It is also given with the lidocaine to prolong the action of the lidocaine. So preparation is 1 in 2 lakh to 1 in the 80,000. Then non-adrenaline. Non-adrenaline given by the slow IV infusion, that is 2 to 4 microgram per minute. Local tissue necrosis occur if the solution extravasate. Do not mix with the sodium carbonate in the same bottle because rapid oxidation occurs at alkaline pH. Action start declining within 5 minutes of discontinuing infusion. Now we will see the adverse effect. So first is adrenaline. The adverse effect of adrenaline are an extension of its pharmacological action. They are tachycardia, palpitations, headache, restlessness, tremor, rise in blood pressure, hemorrhages and cardiac arrhythmias. They are contraindicated in situations like hypertensive or the hyperthyroid or the angina patient. Adrenaline should not be given during anesthesia with the halothane. Selective B2 agonist. Tremors, tachycardia, palpitations, hyperglycemia and last is hyperkalemia. So let's discuss some questions. A 12-year-old present with fever, sore throat and cervical lymphadenopathy. She is diagnosed with streptococcal group A pharyngitis and IM penicillin is given. Within a minute, she is displaying with wheeze, tachycardic and hypotensive. Best treatment for this condition is. So answer is adrenaline, IM 0.5 mg, 1:1000. A carpenter present to ER after an accident in which he chopped off his tip of the index finger. He is taken to OT and a local anesthesia is given. Around the site of injury, local anesthesia given. Dose does not contain the epinephrine. The reason is. So epinephrine can lead to vascular ischemia in the digit because it is a vasoconstrictory action of the epinephrine. 5-year-old female prescribed salbutamol through metered dose inhaler at the time of onset of acute attack of bronchial asthma. The bronchodilatory action of the salbutamol is due to activation of the which pharmacological phenomenon shown below. So it is del vasomotor reversal.